my experience during this year, I've seen all the patients 1 day post-ablation, and almost none of them have any symptoms of pain. And it was in the beginning we were really surprised, because even when we were doing a bit beyond PVI, a bit more extensive ablation, if you would do something like this with using the cryo balloon or using the radiofrequency ablation, we were seeing that they had some kind of initial pericarditis, which we needed to treat them. But with FARAPULSE, we haven't seen these complications, so we should look at the future. But 1 day after the procedure, we don't see any complication like pericarditis, for example.
As EP fellows, we are, of course, visiting patients every time after the procedures, the day after. And I can say that during my experience, I've never heard of any patient that had any pain, post-procedural pain, or chest pain after the procedure.
My personal impression is that the patients recover faster after the procedure, and they complain less about thoracic pain as compared with RF technology ablations.
They don't experience pain after the procedure. It's really striking difference compared to patients treated with RF or cryo. You see a big difference. They feel very, very well and comfortable.
After FARAPULSE procedure, the patient had no pain. He had with cryo and RF, especially due to pericardial irritation. With electroporation, the patient don't have pain at all, and it's really comfortable for them.
No, FARAPULSE is really the next step, because what we experienced in our center was that with the cryo balloon we have a less problem coming from a radiofrequency concerning about patient and pain, post-procedure, inflammatory reaction, everything. Of course, PFA with FARAPULSE is the next step, so the patient complain even less now. They have a very fast recovering. They do not have any bad experience. That also open the possibility to engage the patient for a long term.
I haven't have any patients who had complained, actually, because the procedure is much shorter. We do these procedures in general anesthesia. I find that the patients are much more alive the next day. When I go up to see the patients in the morning, they are already packed and ready to leave the hospital.
Patients feel fine after a PFA procedure. They're not experiencing any pain. There's no incidence of pericarditis so far in our patient group. In fact, they feel really fine.
This is really something that we are experiencing that is completely different, especially for extra PVI patients with RF. They often complain of pain the day after. With FARAPULSE, we have not been observing this, so we are very happy. The patient is happy. Everybody is happy.
In our experience, the patients are really happy after the procedures. So not only that they don't experience pain or discomfort like with thermal energy, but they express the good feeling when we discharge them.
Well, actually the patients feel great with RF or laser. Now and then there's someone with pericardial pain, but after the pulse field ablation, the patients feel great. All our patients, or most of our patients, go home the same day already.